there are concerns that people at some public gatherings are not taking precautions against COVID. Dr. Peter Hotez is a professor of pediatrics and molecular virology at Baylor College of Medicine, and he joins us now to discuss. Good morning. Good to see you.
Good morning. Nice to see you.
So, Dr. Hotez, when you see these large crowds and packed stadiums, what goes through your mind?
Well, what goes through my mind, Vlad, is that we're having this incredible surge right now of COVID-19, although it's unevenly distributed in the United States. Right now in the South is on fire. And in terms of this raging epidemic, in terms of number of new cases, especially among young people. And now we've got 100,000 Americans in hospitals right now as we're speaking, and the deaths are climbing to over 1,500 deaths a day, almost all of them among the unvaccinated. And so it troubles me that we somehow have decided this is over, and the Delta variant now is surging across America.
Along those lines, there's a lot of talk about boosters, and according to the New York Times, federal health officials have told the White House it's time to scale back that booster plan for a third shot. What is your take on some of the mixed messages that we're getting right now around it?
Yeah, and I think it's really important, Dana, to break it down by individual vaccines. So the Pfizer-BioNTech vaccine, the data coming out of Israel is showing that the effectiveness of the vaccine has gone down from over 90% to 40 to 50% over a 6 to 8 month time period. And that's actually to be expected based on how the vaccines were initially rolled out when those first two doses were spaced so closely together. So many of us always thought this would be a 3-dose vaccine, and now we're seeing that decline. The good news is that we're not seeing a lot of breakthrough hospitalizations or deaths, but we are seeing breakthrough cases and breakthrough long COVID. So I think that's going to be the basis for the third immunization. And the FDA VRBPAC committee meeting is scheduled to meet September 17th. So just in about a week and a half to kind of weigh in on this, and hopefully we'll, for the Pfizer-BioNTech vaccine, we'll now move forward on that third immunization. For the other two, we still have not seen a lot of evidence of breakthrough infections or hospitalizations, but my guess is that's probably going to happen as well over time, and we'll see third immunizations for the Moderna vaccine and the second immunization for the J&J vaccine.
Dr. Hotez, we often keep hearing about the second wave, the third wave. I believe we're in the fourth wave, and now we're hearing more about this new variant that's coming out of Colombia. What more can you tell us, and how will that impact us getting to herd immunity?
Well, we have enough to worry about right now with the Delta variant, and let's get our way through that. I'm looking at that Mu variant that could be troubling, but right now it's around. It's not really gaining ascendancy. I think the key is to vaccinate our way out of Delta, but the problem is the bar is really high. I mean, we're looking at the need to vaccinate up to 90% of the U.S. population, and it may require 3 doses of the mRNA vaccines in order to make that happen. And you might say, well, gee, that's not possible. Well, the answer is, of course it is. We do it every year for measles. We should be able to reach that bar.
Dr. Hotez, we're seeing an increase in cases among children right now, many of whom can't get vaccinated. So what needs to be done to keep kids safe as they prepare to go back to school?
Yeah, really important question. And the answer is get anyone who's eligible to be vaccinated, get vaccinated. Because what we're learning now is that the little kids who are under the age of 12, not old enough to be vaccinated, are often getting infected from unvaccinated adults, either unvaccinated adults in the home, and we even have a report now from the Centers for Disease Control of an unvaccinated teacher. So it's really key that anyone who's eligible to be vaccinated get that vaccine. And really, in a school setting, right, in my opinion, anyone over the age of 12 who goes into that school has to be vaccinated, and that will make a big impact. And we're already seeing it. You know, if you look at what's going on in the New England states, where they've done such a good job of vaccinating all of the adults and just about all of the adolescents, they're not seeing a lot of little kids get infected. Very different down here in the South, where tragically adults and their adolescent kids have been defiant of getting vaccinated. So we have to fix that.
Dr. Peter Hotez, we thank you so much for joining us this morning.